the creative life. So, they say, I haven't spoken to mom in a while. I haven't spoken to my dad. I haven't spoken to this. I haven't spoken to Araba about the guy I met. All the gist you've been waiting to do. Well, now it's time. Yeah. Today is a good day to do all the catching up. We are 25 years old, and as part of saying thank you for your loyalty, your first call of the day is on us. Yeah. Just call another MTN number and you get to talk for 25 long minutes for free from now till the 30th of June 2021. Yeah, thanks for being with us and for us for the past 25 years. So go on and make that call because it's a good day to be on MTN. Let's go. MTN. Everywhere you go. Terms and conditions apply. That's right. And the Access Bank Perfect Start promo is getting even more exciting. Over 400 children have been rewarded in the Quizzy Sunday Games and Access Got Talent competition. We want you and your kids to be part of the Perfect Start promo today and experience the entertaining and rewarding way to save. Be part of this exciting promo by depositing 200 Ghana cedis or more in your new or existing early savings account, and you and your kids can be on your way to winning a share of a whooping 100,000 Ghana cedis cash prize. Now keep depositing more to build up to 2,000 points that will qualify you for the mega reward. And there's more. Your kids can win for themselves that PS5 they've been asking for, or that bicycle you promised them, or that Samsung tablet they need for their online classes. And of course, cash prizes they can win into their early savers account when they participate in the weekly Quizzy Sunday and the monthly Access Got Talent competition. Savings just got exciting and rewarding with the Access Bank Perfect Start promo reloaded. Be part of it today. You can visit www.accessbankplc.com or /early savers, or you can call our toll-free number 0800 004400 for more details. T's and C's apply. Access Bank, more than banking. Our drive doctor is the CEO of Medicas Hospital in Medina Firestone and Mampong Equiapim, Dr. Yao Osafo. Hi, Doc. Hi, how are you?
Hi, Lexis. I'm very, very well.
Nice. I'm very well, too. Good to see you.
Yeah.
Yeah.
I love the song you were playing while I made my entrance.
You say you did what?
I love that song.
Oh, you love that song,
Yes,
eh? Oh,
yes,
that's why you were doing
absolutely.
those alo moves, eh? You need a dancing doctor. You need to come and see me. Let me teach you a thing or two.
I think I'll let Abi. I think my chances with Abiku.
Why?
Abiku.
Sound coffee.
Oh, yeah.
Oh my goodness. Anyway, really good to see you. So last week we concluded our discussion on Candida. Right?
Absolutely.
And we promised our listener that this week would have an open clinic so that they can ask questions, because a lot of people wanted to know a little bit more about it. They had questions that we couldn't answer. And we haven't had our open clinic as well in a while. In the past couple of months, we've been talking about other conditions like the urinary tract infection, the blood in the urine.
Blood in the urine.
The one where I go by, say urine in the blood. And
Yeah, come on, I met some before sitting outside.
oh, you did.
I hope he's not
He put
listening.
me up to it, yeah. And then the
Yeah,
blood
we
in the
even talked
poop
about
as well.
blood in the poop
Yeah.
as well, bleeding per rectum.
Yeah.
And then remember that in April was Testicular Cancer Awareness Month.
True.
So for the first time, I think we paid a bit more attention to what men have got in between their legs, because
Yeah.
we don't usually talk about that. So yes, in the past 2 months, we've had quite a bit to talk about. So today, we're going to field as many questions as we can.
All right.
Try and get more explanations to people.
Good stuff.
But Kwame, there's a very interesting that's happening at Medicas this month.
Okay.
And remember I was here with a very fine, swagalicious
Yeah.
doctor.
Dr. Yuinchi?
Yeah, with his slang.
Yeah.
Or maybe you.
Oh, he's coming back.
Oh, he's back.
Wow.
He's
The
back.
spine doctor.
Yes, the spine doctor. He's the spine surgeon.
Okay.
Who visits us every now and then from the United States. So Dr. Yinchi would be in Ghana on the 12th of June.
That's in a few days.
Yes,
Wow.
that's
this weekend.
Yes, this weekend.
Okay.
Hopefully it will be here, and then yes, as usual, we will see what we can do.
So you'd have a spine clinic?
we'll have a special spine clinic with him in attendance.
How long will it run?
It will run for a week and a half, probably two. We
Okay.
said a week the last time around. We ended up doing 2 weeks because
Yeah.
the numbers were just a lot.
So if you
Overwhelming.
missed out on that, well, this is a good opportunity to.
Right. So at the end of the
Yeah.
show, we'll give out a number so people can reach out.
Okay.
So anybody with back, neck, back problems, be a good opportunity to come in during the special spine clinic. It's just him. The whole team
Oh,
will
wow.
be available to see as well.
Wow.
Probably bring him into the studio to talk a bit more about the spine.
Yeah.
When he gets here. And
Let's have a
maybe
session
next
on
week.
that. Yeah, we can have a session on that next
Absolutely.
week. Yeah, I miss his ruffle.
Yes, you come and slang on us more.
Yeah. You know, I used to talk like that, but you know, cause I had to vibe with you, like you and all of that. So I had to water down my slur a little bit.
You
You know what I mean?
To practice.
Otherwise, you'll not be able to hear what I'm saying. So, I mean, it would be good to catch up with him. You know what I mean?
He's listening.
he's listening.
He's listening online.
I'm sure he's crapping out. Anyway, okay.
Right.
So let's cut to the chase. Already, some questions are coming in on our WhatsApp platform. Whatever question you have for the drive, doctor, concerning the topics that we talked about, or probably I'm sure we can have space for other general topics
other general
as well.
topics as
If you have any question for the drive, doctor, you can send it to us on WhatsApp 055 or you can call us 0302216541. Now we have enough time to do that. But briefly, before I get to the phone lines, Doc, maybe you can do a quick summary on the Candida bit for us so that we can now get to the phone lines.
Very interesting microorganism we've been talking about the past 2 weeks. Candida, which is a type of fungal infection. Commonly, women are the ones who bring it to attention because they get infections down there. And in our environment, typically we call it white. In the Ghanaian environment, that's what they would refer to it, white. But I think in the past 2 weeks, I have mentioned that it doesn't only cause infections down there, but then you can also have mouth and throat infections caused by the same Candida. And then also you can have nail infections caused by this fungus as well. Typically, when your immune system takes a hit or is suppressed, that is what increases your risk for developing the infection. Some of the symptoms that show that one has developed an infection would include an unusual or an abnormal discharge. Abnormal discharge, and that discharge is typically whitish. It's a bit chunky or very, very thick. It causes a lot of itching or burning sensation down there as well. And the individual might even have pain during or immediately after sex. So that's for the typical Candida vaginal infection. When you have Candida infection too of the mouth, it tends to also present with sores or white plaques or patches in the mouth, typically the roof of the mouth and then the back of the mouth, and even on the tongue as well. It can cause some burning sensation and make it difficult for you to chew or tolerate food in the mouth. Men and women are afflicted equally. We also mentioned that certain sexual practices also would increase your risk of developing that. When we looked at some of the treatment options, we realized that things like douching, which sort of like reverses the balance, the normal balance between bacteria, the good bacteria, and Candida in that area, is one of the prime reasons why risk factors for developing Candida infection. So the advice was that women should not douche, but rather just to clean that area. The use and abuse of antibiotics generally is also something that is not encouraged. We looked at some local remedies, and I remember we talked about some essential oils, and I think I mentioned one oil that I was surprised that you knew, probably knew about, because I didn't know that you were so that or in tune.
Oh,
With,
I mean,
the oil of oregano and then also the Greek yogurt.
yeah.
These are things home remedies.
Home remedies, yeah.
That can also be helpful in treating.
Since we're talking about the oils, I need to put it in here that Ava coconut virgin
coconut
oil.
So coconut oil has actually the best scientific evidence for treating candidiasis in women.
Okay.
You know.
So Vesta and the team at Ava brought us boxes of coconut oil.
Hey,
but
nice.
this time, you're the best chinkusia.
Yeah,
You're Candida. You're the best
chibum. Yes. So
thanks to the Vesta and her team.
The whole team out there. Yes, coconut oil has a lot of medicinal uses. So it was very, very striking to have to come across that as some of the important things. We also mentioned apple cider vinegar as something that can be used as well.
Okay.
So that's by way of recap.
Yeah, this is a recap of the conversation we had on Candida.
Right.
But like I mentioned, you could ask any question on any other topic that we've discussed.
Yes.
Bleeding per rectum or blood in the urine.
Right.
Or UTIs.
Yes. The testicular swelling.
Yes,
if
as
you're
well.
A man and you're concerned about, the size of your scrotum or the absence of one of the nuts in there, so feel free to send in your questions.
Yeah.
And then we will try.
So the number to call is 0302 216 541, or you can WhatsApp us on 055 1111997. I need to mention here that the lady who sent us the issue on Candida sent a message over the weekend, and said that I got a solution to my problem.
Oh, wow.
And
Nice.
I'm most grateful to you and the doctor and the whole Joy FM for the good job. So she says, God bless you. Yeah?
Very
All
good
right.
feedback.
Let me get on the
Very
phone
good
line
feedback.
now. Hello?
Hello, Elijah. Good afternoon.
Good afternoon, bro.
And afternoon to doctor.
Yes.
Hello, good afternoon.
Oti Boate from Tema.
All right, Oti, go ahead.
Yeah, let's want to know. This Candida can it stop the sperm? If it's going to the woman's womb, can Candida block it, or if you have it, you can't have children because of the Candida?
All right, so I think what he's referring to is something we call a pelvic inflammatory disease, where this is typically an ascending infection of the womb, or the lining of the womb, and the tubes. Okay, you have one on the right and then the other on the left. If you have repeated infections which are not treated properly, then it tends to heal. The body tries to take care of the infection itself, but then this happens and it leaves the woman with a lot of scarring, a lot of fibrous bands. You can imagine them to be like rubber bands that we use to hold bundles of money, and these form and obstruct the lumen of the tube. And it is these tubes that connect the ovary, when it produces the eggs, and the eggs travel through the tube to meet up with the sperm and then form the human being. And then the fertilized egg then travels down again into the womb for implantation and development of the embryo. So yes, if a woman is having an ascending infection and she develops a PID, which is an infection of the womb and the tubes as well as an ascending infection, it can, if it's not treated properly, it can lead to infertility.
Okay.
So it is one of the commonest reasons, PID, why women are infertile. And sometimes you can have what we call tubal surgery to open it up and try and free up the obstruction within the lumen of the tubes. So we will always say that the infections should be properly diagnosed and promptly treated to avoid the body taking care of it. The pain and discharge might go down subsequently, but then you would have healed and left a lot of scarring, which then obstructs the pathway for the egg.
Okay.
Makes it very fertile.
Let me see who's here. Hello?
Hello,
Hi, you're welcome. What's your name?
my name is Nanekia.
All right, Nana, go ahead, Nanekia.
Okay, so I just want to ask Doc. He mentioned, he's listed a couple of treatments that you can use, the olive oil. And how do you rub that or you take it in?
Okay. You're talking about the application of the oils.
Right.
Exactly.
So
Yeah.
there are different types of oils. I think I remember last week I mentioned two different types. The essential oil of oregano. There are, even that one, there are two types. There's one that you find in the spice section in the grocery shops, and then there's another type. So we're not talking about the one for the spice. Even with that one, we do not apply directly to that area. You do not apply it directly. So for the essential oil, it goes in what we call a carrier. You dilute it in what we call a carrier oil. That carrier oil can be olive oil or almond oil.
Okay.
So you take 1 or 2 drops of the oil of oregano into the almond or olive oil, an ounce of it. Uh-huh. And then you apply it to the skin in massage. So you can apply it to the skin of your thigh, the buttocks, the back, and it's absorbed intradermally. You're not even applying it directly to the 18, for want of a better word,
Oh, okay.
for the oil of oregano.
Okay.
But for coconut oil, then you can do a direct application
Okay.
in that
Okay.
area.
All right. 0302216541. Let me read a couple of the messages here. Kwame in Adenta says, I want to ask Doc. I noticed my 18-month-old boy started limping when running and sometimes when walking. I tried to massage the feet up to the thigh area to see if he had some pain somewhere, but he showed no sign. Please ask Doc if there's something dangerous about this or it's normal with kids at his age.
Right. So this child needs, we need to see this child physically. He's talking about a limp, 18 months. One thing we know about children is that if they have pain in any part of their body, they are most likely not going to use that part of the body. So if the child had pain, it probably will not be running. Is it possible that one limb is shorter than the other? That's a possibility, and that would be a congenital abnormality. So I would say that most likely it's painless. It may be that he has a structural problem in terms of the skeleton, one being longer than the other, and it's only a thorough examination by a physician that will bring these things out.
Yeah.
Probably may even need to see an orthopedic surgeon for a much more thorough evaluation.
Okay.
So that would be my answer.
Lots of messages on WhatsApp, and I am hoping we'll be able to get through all of them. Kobna in Akosumbo says, I just tuned in and I heard you mention something on rectum. He says, sometimes I bleed like I'm having menses around my rectum.
Whoa.
Can you touch on this for me?
Right. So I think we spent 2 weeks talking about bleeding per rectum. We
Yeah.
had 2 lengthy weeks about that. So there are a lot of differentials, and I always start by saying that it is a no-no. You should never see blood in your poop. And the patterns of bleeding are very, very important. So sometimes it is bright red bleeding, sometimes it is dark blood that comes out.
Yeah.
Sometimes you find the blood when you wipe using the toilet paper. Sometimes you find only blood in the toilet bowl as you bear down. Sometimes the blood is found on the surface of the stools. Sometimes the blood is mixed with the stool. So all of these patterns of bleeding will assist your doctor to narrow down on the differentials, and we mean the possibilities. Commonly, piles is what we see a lot. A lot of it depends on the age group as well. The young person who has that will think of piles or hemorrhoids. There are different types of hemorrhoids as well. First degree, second degree, and then even third degree hemorrhoids. But there are other medical conditions, some more sinister. For example, you can have cancer of the colon or cancer of the large intestines. That can lead to bright red bleeding. Dark blood or black bleeding typically tells us that the bleeding is coming from higher up in the gastrointestinal system. Higher up meaning the stomach, most likely. So somebody with a bleeding peptic ulcer, most likely by the time the blood comes down, it would have interacted with so many other different chemicals such that it turns out to be black. So for him having such profuse bright red bleeding, I would think that he either has piles or he has what we call diverticular disease. He will need to be seen, to be examined physically, and then most likely we'll ask him to do what we call a colonoscopy, or a visualization of the lower intestines.
Okay.
And that is absolutely essential. The only thing that makes doctors run most of the time is blood. We don't want to see blood. Yes.
0302216541. This one says, what about blood after urine? Any remedy?
Right. So again, when we talked about the blood in urine, I think I discussed, and I think the terminology I use is hematuria. And again, I talked about the different patterns of bleeding that we notice in the urine. So when we say blood in the urine, we've got what we call the initial hematuria, where you feel the urge to pass urine to empty your bladder. And then in the initial stages, it's all just blood that comes out before the urine comes. Then you've got total hematuria, where the whole the whole urine stream, the 2 minutes or 1 minute that you're urinating, it's all blood from start to finish. Then we've got one we call terminal hematuria, which is what this person is referring to. The urine starts, it's all urine, and then at the end, then you see blood. In our part of the world, typically that will point to a disease we call bilharzia, or we used to call bilharzia. Now we call it schistosomiasis, or schisto for short.
I think that's one you said it's quite common with people who lived along the river banks.
Exactly. So the Lake Volta, or the Volta River, which runs all the way from the northern parts of the country all the way down here to the coast, along the river banks of the Lake Volta, for example, and these people bathe in the water, they fetch water for cooking and all of that. There's a snail that's a vector for this particular organism, which is found in these water bodies, and that is why people who have lived in there are likely to be affected. So again, blood is a very, very unusual event for us to have, except a woman is in her menses. So I would advise that you see your doctor immediately. And there are so many different possibilities. I'm talking about schistosomiasis, but there are other possibilities about bladder cancer, bladder stones, and so on and so forth. Even sometimes a very severe urine infection can cause one to experience some bleeding.
Okay. Good afternoon, Lexis and Doc. Can the doc have a session on Bell palsy?
Oh, okay. All right. So Bell's palsy. It's one of those very dramatic presentation of disease. But yes, but it's a very dramatic thing. A lot of people think that they are having a stroke. So idiopathic facial nerve palsy. So the facial nerve is one of 12, we call them the cranial nerves. All right. So the number 7 one is called the facial nerve, and it comes to the face. So all the faces that you can make, frown, smile, furrow your brow, all of those things, show me your teeth, and things like that, are all controlled by this nerve. Some people wake up and you've got a pair, one on the right, the other on the left, and it comes out in front of the ear, in front of your ear. And then it has 5 branches that go from your forehead all the way down to your chin. So every face that you can make is controlled by this facial nerve. All right. And you can wake up one morning and all of a sudden one facial nerve is paralyzed. So you cannot even shut the eye on that affected side.
Wow.
If you try and show your teeth on that side, your mouth deviates to one side because that side of your mouth doesn't move. You can't hold water in your mouth. So most people wake up and the first thing they want to do is rinse their mouth with water. And you try and put the water in your mouth and it's all dripping from the angle of the affected side. All right. So it's a very dramatic presentation. Most people think that they are having a stroke, but you can move your hands and legs and leg on that side of the body, but there's no sensation on that side of the face, and you cannot move that side of your face. We call it idiopathic because we do not really know the cause. There's some theories that have been proposed. We think it's a viral infection, but we really don't know what brings it about. People make recovery, and I have a few patients, they made very remarkable recovery, and they think that I am a magician. But I told them that, well, you get your face back. But it is very, very dramatic, and it's very, very scary if you don't know what it is.
Yeah.
Most people think that they are having a brain event or a stroke, but it is paralysis and sometimes a temporal paralysis
Okay.
of that facial nerve. But I know somebody who's had it for 4 years as well with very little improvement. So on a few occasions, it can be a bit protracted.
Okay. Lexis, please ask Dog, why do I experience severe waist pain when I constipate? Papa Intema.
Ooh, okay. All right. So constipation and then waist pain. It may be connected or it may be different pathologies. So it may not always be that it is the constipation that's leading to the waist pain. But the spinal cord, when it gets down to the waist level, gives off a lot of branches that go to different parts of the body. Our intestines are also supplied by nerves, and that is how come we're able to move things along. So if you are constipated, your muscles of the intestine are not working very well, so you're not moving things down pretty fast, and it gets distended with both fecal matter and then with a lot of gas. Everything gets stretched, so probably the nerve is irritated, and then you feel the pain all along its pathway to the origin, and other branches that would go probably to your waist as well. So that may be the reason why you may have that connection when you have serious constipation. But it could also be that the bones in your lower back are problematic.
Okay.
I'm sure Dr. Yinchi would love to answer this question next week.
Yeah.
So we'll keep it for him as well.
Okay, I'll add one more question. And actually, it's Abba says she lives at Kitasi and would like to see you. So are you at the Medina branch or Mampong branch?
Both. I'm at Kitasi, so yes, you can come up. Kitasi to Mampong is what, 10 minutes or so. So she can catch me in Mampong on Mondays, Tuesdays, and Fridays.
Okay.
Wednesdays, I'm in
Medina. Firestone.
Firestone.
Okay. So just tell us a little bit more about the spinal clinic, the spine clinic
The spine
that's
clinic,
coming up.
right? So next week we're getting our visiting orthopedic surgeon, spine specialist, coming from the United States. He was here in January rather, and we had a great time with him. It was a very enlightening experience. He's called Dr. Hineku Yoinchi, a bona fide Odadie.
Yeah.
He'll be visiting us again. So
Mami's shaking her head.
we're going to have a special spine clinic again for a week. And Kwame, those who want to reach out and also book for the spine clinic, the number to call is 0501 477 340. 0501 477 340. So the whole team, physiotherapists, dietitians, everybody at Medicus will be ready for the next 2 weeks or so for the special spine clinic.
Okay. And I'm sure they can reach out to you on that number as well.
Exactly. 0501 477 340.
Dr. Yao Safo, CEO of Medicus Hospital, and he's our drive doctor. Thank you so much for sharing this with us. And hopefully next week we can have Dr. Yuenchi also come in and give us some more education about the spine and how to keep our backs safe. Yeah?
Absolutely.
All right. Thank you so much. It's 5 o'clock. Let's find out what's happening in news.